bird flu, or avian flu, continues spread across Canada, causing some experts worry about its potential become more contagious between humans, potentially leading another pandemic. The current epidemic circulating in North and South America is known as H5N1 class 2.3.4.4b. It killed a record number of birds and infected mammals. Although human cases are rare, Shayan Sharif, a professor and vice dean at Ontario College of Veterinary Medicine at the University of Guelph, warned that virus is gaining momentum and is becoming a more human threat. The various pieces of the puzzle come together for this virus to become contagious between humans, he told Global News. And this particular virus has the potential to become a pandemic virus, and if it does, then we definitely need to be ready because the rate for this virus could be much higher than we've seen for COVID-19. Matthew Miller, director of DeGroote Infectious Disease Research Institute at McMaster, said key helping stop spread of this virus something more dangerous is make sure virus doesn't have a chance adapt so it doesn't infect humans in first place. University. While Miller did not specifically mention the possibility of a pandemic, he cautioned that it is urgent to ensure that paramedics act proactively to ensure the virus does not mutate and adapt. 227 Toronto Zoo temporarily closes bird cages. This type of bird flu first appeared in Canada in December 2021. Since then, Sharif said there have been 3 waves. The first was beginning of March 2022, second was around August last year, and he said Canada is now in 3rd wave, saying that we are not at peak of wave, we are just very beginning. Data compiled by the Canadian Food Inspection Agency show that as of Friday, there were 1,829 confirmed and suspected cases of avian flu in animals across Canada. Most cases are in Quebec, Alberta, and Saskatchewan. What is bird flu and why is it spreading now? Some flu viruses mainly affect humans, but others occur mainly in animals. For example, there are flu and swine, or swine, flu viruses that occur in dogs. Then there are avian viruses that spread naturally in wild waterfowl such as ducks and geese, followed by chickens and other domestic poultry. The avian flu virus that stands out today, type A H5N1, was first identified in 1959 by researchers studying the chicken flu epidemic in Scotland. Like other viruses, it has evolved over time to produce newer versions of itself. By 2007, the virus was found in more than 60 countries, including Canada. Over the past year, he announced a major outbreak of the virus in waterfowl such as geese migrating from Europe to North and South America. Miller said these birds spread the virus as they migrated, so epidemics began to spread in the United States and Canada. There is also more spread to other wildlife, including seals and skunks and livestock on mink farms. 416 bird flu found in skunks. For example, 8 skunks found in the Vancouver area last month tested positive for H5N1 avian flu. Health officials said the skunks may have contracted the virus by eating infected wild birds. And last summer, Quebec researchers said at least 2 species seals had bird flu detected as unusually high numbers of carcasses. These mammals hit the province's coastline. That's because the virus is primarily a gastrointestinal infection in birds, Miller said, so it can be spread through feces. However, it can also kill the bird, so scavengers such as skunks can infect them when they eat an infected bird. Does bird flu worry people? The risk of viral transmission to humans remains low, according to Health Canada. Global News asked Health Canada if it was concerned bird flu could turn into a pandemic, and department said it was continually monitored to look for genetic changes that could indicate the circulating virus has improved ability to infect mammals more efficiently. Saying that although overall risk of transmission is low, virus has high consequences for humans, Miller added that rate is at same level as viruses such as Ebola. This is a much more LY virus than COVID-19, Miller said. When these viruses infect humans, the mortality rate can be as high as 50%, which is frankly a frightening number. The rate for COVID-19 in Canada is just over 1%, according to our world data. Because bird flu is so contagious, Miller warns that if people come across a bird or other wildlife species, the risk comes from touching the animal, so people should avoid contact with it at all costs. But Miller added that there is no obvious risk of getting virus from eating chicken or turkey meat, because the virus will be killed when meat is cooked. Will there be a bird flu vaccine? Miller said it's almost certain that drug makers are stocking up on a vaccine for this type of H5N1. Miller explained that the good news about flu is that it's actually relatively simple. Use the technology we use to make current seasonal vaccines and adapt it, make avian flu vaccines. He added that there are currently several seasonal flu vaccine manufacturers that can make avian flu vaccines using their existing infrastructure. 636 increasing concern about the spread of bird flu because manufacturers can quickly reverse a bird flu vaccine, Miller said. This puts us in a very different situation than we were in with COVID-19. Before the pandemic, we not only had the infrastructure to produce COVID vaccines, but we also didn't have human coronavirus vaccines. That's why we are better prepared in the flu area, he said. There is no current vaccine available for poultry or humans in Canada. But Health Canada told Global News that the government is maintaining pandemic vaccine preparation contracts in the event of an outbreak. Currently, Canadians may not be in the mass vaccination phase of the general public, but for those at high risk, consideration should be given, Miller said. This includes poultry breeders, veterinarians and wildlife workers who may encounter the virus in animals due to the nature of their work. Concerned about adaptation to humans, Sharif said the most worrying part of bird flu is its ability to infect and adapt to mammals. And we don't exactly want this virus to adapt to humans and eventually become transmissible within human populations, he said. Sharif said governments need to start acting cautiously. Many of these viruses exist in the environment, but we either don't recognize them or we don't track them, Sharif said. And as a result, we have no idea at what point we should acquire all the necessary requirements to stop it from infecting other animals or humans, he said. It may not be time to panic, but he added that if the virus develops and spreads more easily among humans, it is time to be prepared for a potential future outbreak.